Hi guys, I'm Letícia. I'm Ana Laura. We're going to talk about cystic fibrosis for anatomy class.
So first, to understand cystic fibrosis, let's talk about systems. Cystic fibrosis is a monogenic disorder which causes a multi-systemic disease. It doesn't just affect one location, but all locations that have epithelial cells that have a defect in this protein, especially the lungs and pancreas. The respiratory and digestive systems are most affected. About respiratory system, upper respiratory tract, formed by the nasal cavity, paranasal sinuses, pharynx, and the upper portion of the larynx, above the vocal cords. Its function is to conduct, filter, humidify, and heat inhaler. Lower respiratory tract, formed by the lower portion of the larynx, below the vocal cords, trachea, bronchioles, and lungs. Its function is conduction and gas exchange. In the nasal cavity is where the upper tract begins, and this also contains the nasal turbinates. The two openings of the airway, the nasal cavity and the mouth, meet at the pharynx at the back of the nose and mouth. The paranasal sinuses communicate with the nasal cavity through openings. The pharynx is part of the digestive system as well as the respiratory system because it carries both food and air. The larynx, or voice box, is top part of the air-only pipe. This short tube contains a pair of vocal cords which vibrate to make sounds. The tracheobronchial 3. It's a portion of the respiratory tract that conducts air from the upper airways to the lung parenchyma, formed by the trachea and intrapulmonary airways, bronchi and bronchioles. About the lungs, the right lung is larger than the left. Each lung has three surfaces, an apex and a base. The surface of the lung are the costal, mediastinal, and diaphragmatic. The apex of the lung is where the mediastinal and costal surface meet, and is also the most superior portion that extends to the root of the neck. The base is the lowest and most concave part, which lies on the diaphragm. So, what is it? Cystic fibrosis is a genetic disease that causes thick mucus to build up in the lungs and digestive tract. It is the most common type of chronic lung disease in children and young adults and may result in early death. The most common lethal in heart disease affecting Caucasians, not uncommon in Asians. Cystic fibrosis is also known as salty sweet disease. This is due to the large presence of sodium in sweet, contributing to the perception of salty or sweet.
So with people with CF, the CFTR protein to become dysfunctional. So when the protein is not working correctly, is unable to help move chloride to the cell surface. Without the chloride to attract the water to the cell surface, the mucus in various organs becomes thick and stick. In the lungs, the mucus clogs air areas and trap germs like bacteria, leading to infections, inflammation, respiratory failure, and other complications. Some of the symptoms are very salty taste in the skin, persistent cough, frequently lung infections, including pneumonia and bronchitis. We have poor growth or weight gain in spite of the good appetite, nasal polyps, and male infernally. Change to exams. In the chest CT, we have cystic bronchiectasis, mucoid infections, error of centrobulopathies, subpleural bullae, and we also have large shadows. That means we have a lung collapse and hyperinflation. So the diagnosis should include a newborn scream, a sweat test, a genetic or carry test, and the clinical evaluation at the CF Foundation. Although most people are diagnosed with CS by the age of 2, some are diagnosed as adults. A CF specialist can order a sweat test and recommend additional tests to confirm the CEF diagnosis. About treatment, medicines can be used to help reduce the levels of the mucus in the body and prevent and treat the chest infections. Any kind of physical active like running, swimming, or football can help clear mucus from the lungs and improve a physical state and overall health. A physiotherapist can also help keep the lung and the air areas clean. Can also teach techniques to help keep the lung and airways clear.
Thank you guys for watching.
I hope you like it.